A warning today from the CDC about trying to get the virus like we used to do with chickenpox just to try and get better immunity. As medical reporter Liz Bonis explains, you could also be left with a lot of lingering health problems.
Hey there, everybody. Hello to you. There is new evidence today that even with Omicron, those who've had the vaccine and then get the virus may have a super immunity which protects against the same variant and maybe others. But the CDC is warning all of us today that hanging out with others to get sick on purpose just to try and get super immunity is risky, vaccinated or not.
At this point, we still don't have a guarantee, or we don't know who's going to potentially have a severe form of COVID.
McKenzie Grinalds is an assistant professor of pharmacy at Cedarville University and works at Ohio's Miami Valley Hospital. The university provided this video. Even though research just released from the Journal of the American Medical Association and the Centers for Disease Control does show that getting the virus, especially after vaccination, boosts immunity, there is no way to tell who will have complications, even with a mild case of Omicron.
People have heard of long COVID. Patients and people can still have some symptoms and other complications that last even after they recover from that immediate COVID infection.
According to the CDC, those complications could include everything from long-term excessive fatigue to erectile dysfunction and increased risk for developing diabetes. You also need to know that if you get sick now, the medications to treat COVID-19 are in very short supply, and you likely won't have access to them unless you are severely immunocompromised or at high risk of dying from the virus. Now, since immunity does wane, however, we don't know how long yet this super immunity even lasts. I'm medical reporter Liz Bonis. Now back to you.